Today we're going to go over Chapter 9, Injectable Preparations with Clinical Applications. This is coming from your dose cal book, so clinical calculations. So the learning objectives are, we want you to be able to select a syringe that's appropriate for whatever medication you are going to give. We want you to be able to do the dose calculation for the administration. We want you to be able to reconstitute or mix medicines to get them from a powder to a liquid. And we want you to know where you can inject and what those landmarks are, what are the injection sites, and how to administer either an intradermal, which is like a TB skin test just under the skin, subcutaneous for medicines like insulin and heparin, and then an intramuscular injection. So any injection that goes in the muscle, a lot of times those are vaccinations or antibiotics. Okay, so these are all parenteral medication routes. And basically parenteral just means we're injecting it into the body. Whether that is through an IV, intravenous, or into the muscle, like I said, IM, sub-Q into that subcutaneous fat, or the intradermal, which is just under the epidermis into the dermis. And so you can draw these from vials and from ampules. Make sure that if you draw anything from a glass ampule, that you always use a filter needle, because if you don't, when the glass ampule is opened or cracked, those little glass shards can get down in the liquid and the medication, and when you draw it with a regular needle, you will have microscopic glass in there. So it is very important that when you draw from a glass ampule that you always use a filter needle. And so when you get a vial of medication, it can be in a powder form or a liquid form. Obviously, in order to inject something, you have to have a liquid. And so those that are in powder form, you should have instructions with the medication that tells you how to reconstitute it. And all that means is to mix it. You're going to add liquid to it and dissolve the powder. So you have go from a powder to a liquid. And so you can use different types of needles and different types of syringes. And so our standard syringe is just a hypodermic needle. And we use that for most injections. Well, then for a TB skin test, we're going to use a tuberculin needle. And so these are made for really small volumes, because the most that you can put into the dermis for an intradermal is 0.1 milliliters. So that is a very small amount. So you need a special syringe to pull up that. And we just call them TB syringes. And then also for insulin has a special syringe, because when you draw up insulin, you're going to draw it up in units. And so an insulin needle is not in milliliters, it is in units. And so when you calculate how many units, to say that you need to give 2 units of insulin, you will actually pull on the syringe until it says 2 units, not milliliters. Those are usually 1 milliliter syringes, so they're very small and have a special needle. So do the TB syringes. And so you have different size syringes, and you just select this on the amount of volume you have. And so if you're only pulling up 1 milliliter, you wouldn't want a 10 milliliter syringe. Also, you can give a fraction of a milliliter. And so if you want to give 0.5 of a milliliter or 0.25 of a milliliter, the smaller syringes are the only ones that will show that measurement. And so a 1 milliliter syringe would show things like 0.2, 0.5, 0.25. and a 3 milliliter will show some of those. But once you're past a 3 milliliter, like when you're getting into a 5 and a 10 milliliter, you can't see those measurements. And so you wouldn't use those for a small amount of liquid. So basically, you just select the syringe based on how much volume you need to draw up. Again, a TB syringe is calibrated, or it shows little tick marks by the tenths. And so you can draw up that 0.1 milliliter. And those come in typically a 1 milliliter syringe, but you can find them in a 0.5 milliliter. Also, sometimes you may get medications like Lovenox, which is an anticoagulant, and it's a sub-Q injection. And those are already pre-drawn up in a syringe. When you get them from the pharmacy, they're already going to be prepared in a syringe. So let's talk about what is a syringe. What are the components of a syringe? So the bottom is the hub, and you can see on the photo. And then the main part, the long skinny part, is the shaft. And then when you're talking about the needle, there is a bevel. And so the bevel is the angled end of the needle, and you can kind of see where the needle opens. And so, for example, on a TB skin test, you would put that bevel up, so where you can see the opening at the end of the needle the opening is facing up. And so the needle gauge is the diameter of the actual needle. So how wide across is that needle? How fat is your needle? That is the gauge. The interesting thing about gauges is the higher the number, the smaller or the skinnier the needle. And so if you have a 25 gauge needle, that's actually much smaller than a 20 gauge. Whereas a 20 gauge is really fat, a 25 is really small. So however high the number is, it's actually a skinnier needle than a lower number. So what do we need to factor in when we're selecting needles? So first off, you need to know the patient's size. Is this a child? Are they small? Is this an adult? Is this an obese adult? Is this an elderly patient who is emaciated, which means they're really, really skinny or malnourished? How big is your patient? Also, how much fatty tissue do they have? If we're going to do a sub-Q injection into the fat, can you pinch fat on this person? And then where can you give it? So if you have a sub-Q injection, you give those in different locations than IM injections. And so you have to know, okay, where on the body are appropriate to give sub-Q injections, or an IM injection, or an intradermal injection. Also, you need to think about the medication viscosity. And all that is how thick is the medicine. So most medications that we inject are going to be really thin. So like insulin and heparin and tuberculin, those are really, really thin medications. But something like an antibiotic like Rocephin, a lot of you get Rocephin injections when you go to urgent care, and they'll inject the high part of your butt. Well, those Rocephin injections are really, really thick. So they're viscous. It's thick. So not every needle you can push that medication through. And so when we do an IM injection, we may use like a 23 needle, but when we do Rocephin, we might need something larger, like a 20 gauge, which just hurts the patient, but also you've got to have a fat enough needle to get the medication to go through because it's so thick. And then we also want to factor in the condition of the skin. How healthy is the skin? Do they have good skin integrity? Sometimes they may have bruising or a surgical injection or surgical scar or a wound. Well, obviously, we're not going to give an injection in those sites. We want to go to a healthy portion of the skin. And then it just lists at the bottom of the screen the 3 different types of injections. So you have those intradermal that go into the dermis just below the skin, like your TB skin test. And then you have a subcutaneous. Oh, let me go back. So the intradermal, you only want to put your angle at around 5 to 15 degrees. The screen says 10 to 15, but I'm going to tell you it's about 5 to 15 degrees. And so that needle is pretty flush with the skin. If you're going to do a sub-Q injection, you want to go in most of the time at 90 degrees. However, if you have a really, really small, thin patient, what we call emaciated, which means that they're very, very skinny, they're very thin, malnourished, then we would go in at a 45 angle for those people. But for the majority of the population, we're going to go in at 90 degrees. And also for an intramuscular injection, we want to go in at 90 degrees. And so for these intradermal, again, these are the TB skin tests. So the photo on this is not a very accurate photo. So that angle that they're at is probably a 45-degree angle. And we want that syringe to be much, much lower. Like I said, it says 10 to 15, but I would say 5 to 15. So you're almost going to be have it flat on the skin. And we do have a lab check off on this in several weeks, and I will demonstrate the angle. So just for now, for test purposes, just know the numbers. And so what we do in intradermal is for skin testing, for diagnostics. So TB testing, allergy testing. Sometimes they may inject a local anesthetic like lidocaine. So maybe they're doing something minor to the skin. Maybe they're removing a mole. And so they may inject a little bit of lidocaine intradermally. And then we have subcutaneous that are going to go a little bit further into that subcutaneous fat. You will learn in fundamentals of med-surg these layers of the skin, but this kind of shows you a little bit of the picture. And so it's a little bit lower, so we're still going to have a short little needle on these, probably near what a TB syringe is. So usually it's going to be about a 1/2 inch long, or 5/8 of an inch, which is just above a 1/2 inch. And we're going to put it in that fatty tissue. These are absorbed slower because there's not a lot of blood vessels there. And these are for medications like insulin and heparin and Lovenox, which Lovenox is a form of heparin. And so the volume, the most that we can put into a subcutaneous site is 1 milliliter. And so no more than 1 milliliter at one site. If you need to inject more than 1 milliliter, you would break it up into 1 milliliter increments in multiple syringes and give it in different locations. And so just like I told you, this says 45, 60, or 90. But for most of the population, again, you're going to go in at 90 degrees. This picture shows a 45-degree angle, and we would only use that for our malnourished, incredibly small patients. And then the type of syringe, we're going to use like an insulin syringe. You can use a TB syringe. They're going to be really small. A 1 milliliter syringe, or most a 3 milliliter syringe. And again, those needles are going to be about a 1/2 inch or 5/8 inch and about 25 to 28 gauge. So they're going to be really short, skinny needles. So for calculations, last week, Unit 3 focused a lot on these calculations. And so you can use any of the formulas that you're comfortable with. The basic, which is kind of that order over available. You can use a ratio and proportion, just a fractional equation to cross multiply, or my preferred method, which is dimensional analysis. So you can use any of these, and Unit 3 went into detail on those different types of calculations. So here's an example that you can use for a sub-Q. And so if you've got an order of 5,000 units that you're supposed to give sub-Q, and the available is 1,000 units per 1 milliliter, you can set it up either the basic way on your left, or the ratio and proportion way, or again, you can use dimensional analysis. So for an IM injection, this kind of shows the layers of the skin. So the muscle is the deepest layer that is right up against the bone. And so for these, we're going to have some really long needles. And so if you look at the bottom of the screen, the needle length, it's just going to depend on the person, but usually 1.5 to 2 inches. If you have a child, you might use a 1 inch, but for the majority of the population, 1.5, 2 inches for adults. The volume that you can put, it depends on the site. And so There are 3 sites that you can give IM injections. You can give one in the deltoid muscle in the arm, and its max volume is 1 milliliter. You can give it just on top of the thigh, a little bit to the outer part of the top of the thigh. That's called the vastus lateralis, and you can give a maximum of 2 milliliters in that muscle. And then you have the edge of your hip on your side, and that is called the ventrogluteal. That is your biggest muscle, and so you can actually put 3 milliliters in that site. And so again, you never want to go above those, but if you do have, say you have a Rocephin injection and you need to inject 4 milliliters, well, you can do it in 2 separate sites. So maybe you do it in 2 milliliters, have 2 syringes that have 2 milliliters each, and do one on the top of the thigh and the vastus lat, and then one on the hip and the ventrogluteal, and that would be okay. But just know the maximum amounts you can inject into the different muscles. For needle gauges, we're going to do, again, we're going to select the solution. So something like Rocephin that is very thick or viscous, we might use a 20 gauge, a 19 to 20 gauge. If it's a thinner, we'll go 20 to 21. And so these are big fat needles that we need to get into the muscle. They're a lot smaller than those sub-Q or intradermal needles. Those are much skinnier. And then the angle, we're always going to go in at 90 degrees for every person, every size, no exceptions. IMs are always 90 degrees. And so here's our sites that I just told you. This screen, this is the dorsogluteal, and so you can still use that, but it is no longer recommended. And if you notice the image, it doesn't even list that on the image because those are really not recommended. We want to give in the deltoid muscle, which is the upper part of the arm. We want to go in the dorsogluteal, not the dorsogluteal. We don't do that one. The ventrogluteal is right there in the side, and then the vastus lateralis is on the thigh. And we want to use what's called a Z-track technique. And so sometimes when you give an IM injection, when you inject it, the medicine will squirt right back out. And so to prevent that from happening, you want to hold your hand and kind of hold the skin tight, kind of move the skin over. And then you want to stick your needle in. Once you've injected the medication, then you hold for about 10 seconds before you pull it out. And then let the skin go, and then last pull your needle out, and that'll keep that medicine from leaking out or from going into the subcutaneous area or the subcutaneous fat. Because the key is we want this to go into the muscle. That's where it's going to be absorbed the best and the quickest. So here's another example. If we have an order of gentamicin for 60 milligrams to give it intramuscular or IM, and then the pharmacy sends us the trade name, the brand name, Jeremicin, it is the same medication, and it's in a concentration or strength of 40 milligrams per milliliter. You can do it this way. This is desired over half or order over available. But of course, you can use whatever method you want. And this tells you that you would inject or draw up 1.5 milliliters into your syringe. So if we've got a medication that comes in a powder, a lot of our antibiotics come in powder. There are some others, but antibiotics in general usually come in powder. And so you inject, and so you may inject different solutions, and always follow the instructions and use the exact solution that it tells you. And so you maybe sterile water or bacteriostatic water or maybe normal saline. Even for when you do Rocephin, we'll reconstitute it with lidocaine if we're giving it into the muscle because it hurts so bad because it's so thick. But just make sure that you inject the correct amount of liquid, but also the correct type of liquid. And also make sure that it's always sterile, always sterile. And so if you're mixing those, you can mix 2 drugs from 2 separate vials, or you can use a vial and an ampule, a pre-filled syringe, just whatever. Just remember, if you're using a glass ampule, you're going to use a filter needle, and always make sure that your medications are compatible. Not all medications are compatible together and can be mixed. So really, we don't really mix a lot of medications unless it's insulin, and there are a couple of types of insulin we can mix. And so if you're going to mix from 2 vials, you want to draw air equal to the solution. So we always draw air when we're pulling up a solution, because it just makes it easier to pull back and it prevents bubbles. And so it's always a good practice. If you're drawing at 1 milliliter from a vial, then inject 1 milliliter of air first. And so you would inject air into both vials, and then you would withdraw the desired amount from each one. And then you want to change the needle. So when we do IM injections, we want to draw up the medication and then change the needle, so we give them a nice sharp needle. And you can draw up medications with big, fat, thick needles. They usually have red caps, and they say don't ever inject these into the patient. We want to only use these for drawing up medication, just for ease. And then you would change that needle to an appropriate needle to inject in the patient. We don't do those for insulin or TB because those needles don't come off. So you would draw up and inject with the same needle. But for everything else, we like to change our needle. If you're going from a vial to an ampule, we want to, again, put the air. We don't usually put air in a glass ampule, but we would into the vial. And always draw from the vial first, and then change and do a filter needle from the ampule. And then, of course, change your needle for what you're going to inject, because you're not going to inject a patient with a filter needle. If you have a pre-filled syringe or something like Lovenox, you're not ever going to mix Lovenox. But if you do, this is how you do it. Make sure you're always checking it. Draw the air into the cartridge and withdraw the solution.